Hello everyone. Today we are going to see the special features of an ambulance to ensure a safer transfer and also to see how to unload and load a patient into the ambulance. Here we have a modern ambulance of Teaching Hospital Peradeniya. Come in. Let's have a look inside. This is how it looks like inside. It has many inbuilt accessories and features to facilitate a safe transfer. This has several compartments and drawers. Here there is a bin and here they have mounted a sanitizer and a box of gloves. And there are several drawers to store drugs, equipment and other accessories. And they have self-locking feature upon closure. These can be used to store drugs. This is an insulated box to transfer medicine that needs to be stored in low temperature and blood products. And you can see they have some straps. There is a separate transfer bag and a separate area to store oxygen. Here they have some more additional space for storage. All have the self-locking feature. When transferring a critically ill patient, power supply is crucial for the function of monitors, infusion pumps, nebulizers, and ventilators. This ambulance has different ports for power supply. 230 AC power supply, 12 volt DC power supply. This ambulance has a nebulizer. As you can see, this nebulizer can be charged with a 12 volt DC outlet. There is this window connecting the front and back cabins, which can be used to communicate with the driver in case of an emergency. This ambulance also has an inbuilt suction apparatus with adjustable vacuum pressures, and this has two oxygen ports. One is connected to oxygen flow meter, and as you can see, you can increase or decrease the flow rate by rotating this. It can give up to 25 liters of oxygen per minute. And the other oxygen supply is connected to the ventilator. This ambulance has been modified for transfer of critically ill pediatric patients. So this has an inbuilt monitor, inbuilt ventilator, and also a defibrillator. Here you can see it can monitor the heart rate, plethysmography, and it gives defibrillation, both automated, external defibrillation and manual defibrillation. Here you can see the pediatric ventilator, so the tidal volumes and the Respiratory rate can be adjusted by this, and you can select invasive ventilation and non-invasive ventilation. And this is the tubing which connects to the patient. Here they have stored all the cables for ECG monitoring, plethysmography, and also they have pediatric defibrillator pads. There is a separate compartment too. And also this has a portable monitor with portable saturation monitoring and heart rate monitoring. There are seats available for 3 passengers in the back cabin. They have seat belts which has to be fastened before the beginning of the transfer. These are the side seats. This is the foldable wheel trolley or the stretcher. It is self-locked once loaded. To unload the stretcher, you will have to pull this bar. Then the stretcher can be slowly lowered to the ground. The wheels will automatically unfold. You can now see how the wheeled legs are unfolded. You can see that the wheeled legs are color coded in green and red. That will make it easy to fold the corresponding wheeled legs by using the color coded handles in the back. And here there are 2 wheels. These wheels will facilitate the movement of the trolley in this dedicated area to store the stretcher. Right. Now we have a patient safely loaded onto the stretcher. The patient is nicely fastened with the straps, and there are these railings to ensure that the patient is well secured. And it also has this bar which can be fixed near the head or end of the stretcher to hang the saline bottles or other medications. Right, now we are going to load our patient into the ambulance. Now as you can see, once the green coded wheeled legs touch the edge of the ambulance, the green coded handle has to be pushed, and then slowly lift the stretcher, and this will make the green wheeled leg to fall. Then once the red wheeled leg touches the edge of the ambulance, you can now pull the red handle so that the red wheeled legs will get folded and the stretcher can be nicely moved along the base of the stretcher. Once the patient is loaded, you can see the stretcher will be automatically locked. Now the patient is safely loaded and ready for the transfer. The sirens can be used to navigate the ambulance in an emergency. Now we have learned how to load and unload a patient and the safety features of an ambulance. Have a safe journey. Thank you all.